Hello, I'm Kieran Lynch and welcome to OviCast, the Chocolate Sheep podcast. Each episode will bring you its insights, advice and technical updates for the sheep industry. Now in a bonus episode from a recent Let's Talk Sheep webinar, we hear an edited extract from Maresa Sheehan, who's based in the Department of Agriculture's Regional Veterinary Laboratory in Kilkenny. Maresa talks about flock health issues that they observe in the lab each spring and what causes them, explaining what approach we should take when issues occur. She goes on to discuss the TNO survey, a new project being run by the RVLs across the country this year. We rejoin Maresa towards the end of the episode where we take questions submitted by the audience on the night.
So I'm one of the vets in Kilkenny Regional Vet Lab. We see quite a few sheep and hopefully we've learned something from that and we'll get to share it with you there tonight. So I suppose we're very much, even when we get animals in here, it's really very useful for us to put that into context and to see what part of the flock health issue that might be. So we're all about gaining knowledge on the health of your flock, because if you know what's wrong, then you can very much deal with the problem. So I suppose we'd be, again, keen to get sheep farmers to know and record what's going on in their flock. So how many adult sheep and lambs die each year? Just as you can measure yourself against industry norms and just pick up somewhere if there's a problem, if there's some issue that you haven't noticed or you're becoming maybe immune to it, and just to be able to compare yourself with sort of industry standards. So what type of animal is dying? What age of animals are dying? Because that'll very much point you towards a diagnosis. And the key thing here then is to try and prevent it and to reduce those mortality rates. Because that's what we need is key performance indicators, target management decisions to improve flock health and improve the profitability and welfare of your flocks. So I suppose this time of the year, we're very much seeing abortions. So most sheep abortions occur after day 100 gestation. The two big hitters are, no surprise, they're toxoplasma and enzootic abortion of yolks caused by Cnidaphila abortus. So again, it's really important to know what is causing these abortions, because there's a lot of agents other than these as well. But also with these agents, you can implement a vaccination policy. And once you know what you're doing, you can also maybe prevent a really bad occurrence in the case of EAE through judicious use of antibiotics in the face of an outbreak. I suppose we did a study back in 2016, and I guess it probably won't have changed that much, just to look at the vaccination frequency. So 54 or over half of the participant farmers were vaccinating against toxoplasma, but quite a low level vaccinating against EAE. So that might be something absolutely to consider if you have a diagnosis of EAE in your flock, because it can be quite devastating in the first year of an abortion storm caused by EAE. Sorry, wrong button. On average, in that study, the submission rate per adult female was 7.6%. I think what's quite useful is to keep the 5-6% level in the back of your mind, because that's usually the level for mortalities above which you need to start getting a little bit concerned and asking a few questions. So these are lambs that we saw this week. So it's quite useful, I suppose, just to warn people, there are a few photos here that I know as farmers you're probably quite used to seeing, but apologies if they're in any way distressful to people. But just from a practical point of view, I thought it might be useful just to show what, look, as farmers, you're all used to seeing as well. So I think maybe it just brings the message home. So I hope that's okay with you all. So these are two lambs. These basically are kind of nice fresh lambs with the placenta. That's what we want to see in the lab. Sometimes we get very autolyzed lambs, and a lot of the times we don't get placenta. It can't be overemphasized the importance of submitting a placenta, both for bovine and ovine abortions, but particularly for ovine abortions, because both your toxo, your EAE, your coxiellas, all those, they really target the placenta. So when we're looking down the microscope, it really helps us to have a placenta, because we can identify agents and it really increases the diagnostic rate. We'd probably suggest 3 aborted lambs at a time. It's probably better to submit more frequently and less numbers, because if we get increased numbers, we start pooling samples in that. So I would submit 2 or 3 of your freshest aborted fetuses, and then if we don't get an answer, and I think it's always important for us to manage expectations, sometimes you just don't get an answer. That in itself is an answer sometimes, but if losses continue, then we really encourage that you submit again and again, you keep chasing it until you get an answer. So this is a placenta with characteristic little white spots on the cotyledons or the buttons of the placenta. And this is what we see with toxoplasma gondii. Again, it's an indicator. We would warn against making any diagnosis just on growth signs alone, and really laboratory testing is needed. And this is the kind of thing, this is actually a bit of brain tissue, and this is a lesion here of inflammation in the brain of an aborted lamb. So we would be pretty happy then that toxoplasma gondii is the agent there. This is a placenta then that has both oedema of the intracotyledonary space and the cotyledons, and this is more of a feature then of the EAE, but again, with the health warning that gross exam isn't helpful. Unfortunately, we see these, I suppose, twisted lambs. Technically, it's a lamb with arthrogryposis. We see these every year also, I guess. First of all, we want to rule out Schmallenberg and some other kind of exotic diseases. But sometimes to know that these are just very unfortunate but occasional occurrences, and we don't get an answer to, but I would stress that it's important to submit these just in case there is an infectious agent involved or some nutritional issue. So this is just comparing a normal brain with a Schmallenberg affected brain. So you could see with that level of damage to the brain, you are going to get those limb deformities. So when to submit, clusters of abortions are greater than 5% of yours aborting. You really need to try and get an answer, because it's all about preventing this becoming a bigger issue or an ongoing issue. So again, aborted fetuses, placentas, and if you can, ask your vet to get some blood samples from yours as well. And we've said that. Okay, so then perinatal deaths. So perinatal, I suppose, refers to that period. It can refer to different periods. It's in the first 48 hours, but I was reading an article in an English journal this week, and they described it up to 7 days. So that's around lambing period. And the numbers of deaths and the averages range, depending on the article or the country you're dealing with, from kind of 5% up to 30% in some outdoor flocks, which if they hit bad weather. But again, I think a useful figure is your 5-6%. If you're going over that level without, a specific cause, you really need to be digging into that and finding what's happening. Dystocia, anoxia, hypoxia is lack of oxygen during birth, so that can be related to slow birthing, ring wound, things like that, or dystocia. Stillbirth can be very much a symptom of one of the abortion causing agents. So your toxoplasma or your EAEs or your Campylobacters can also result in stillborn full-term fetuses. So again, I think the reason I'm putting this up is to just emphasize that it's so important. If your levels are creeping up a little bit and they're of concern to you, then I think it's really important to record what you think is causing those, and to make decisions then for the following breeding season, whether that is your condition of your yolks, your breed type, your if you're outdoors, is there a lack of shelter, things like that. And then obviously the real important things are your clean environment, your colostrum, and then, as we mentioned, you prevent hypothermia. It was very interesting. 2 or 3 years ago, I was at Teagasc session as well, and Tim Keady from Teagasc just reported some investigations he had done, and it was quite, I suppose, interesting, maybe / alarming, of the lack of cleaning out of individual lambing pens that takes place. So that's probably a key parameter that could be improved, especially now that we've entered the era of really discouraging kind of blanket use of prophylactic antibiotics for prevention of watermouth and that. So I thought that was very interesting, the low numbers of people who regularly clean out their lambing pens and refresh those with fresh straw and put down lime or whatever to try and keep that level of contamination in the environment to a low level. This is just a lamb that had a broken ribs. Obviously, it could be mismothering or a yolk standing on a lamb, or else a very difficult birth. Then moving on to death in lambs from a birth to 1 year old, GIT infections, and a lot of these are parasitic disease. In the lab, we see, particularly this year, because particularly we had a very parasite rich, if that's the word to use, autumn time because of the mild weather. Now we're in the southeast, so I know I'm talking to an audience from all over the country, so that'll depend on where you are. But certainly we saw a lot of parasitic problems last year. I mentioned Barber pole worm later, which was a specific parasite, which we saw a really large amount of this year. I think I could safely say that parasitism was probably a very major cause of the mortality that we saw during the lab last summer, and still continuing. And now we saw a case of fluke just during the week. Then on top, and I think it's probably worth mentioning now as well, is the issue of anthelmintic resistance. We are certainly identifying that as a real problem and a limiting factor in sheep performance and reaching targets on a number of farms where we suspect there is anthelmintic resistance, and I suppose more than suspect, have kind of proven with fecal egg counterduction tests that resistance is a real issue. So I think we really have to be aware of that, because I think that is going to become more of a limiting factor on performance on sheep flocks. Then we have, and I know my colleague Charles is going to speak to this about vaccinations, and that your bacteremias, your septicemias. So we're calling them Biberstinia trihaloses and Mannheimia hemolyticas, but they're all in the Pasteurella group. So they're all Pasteurella-like organisms. So when you get acute pasteurellosis, we're still referring to these agents. They've been renamed and that, but it's still acute pasteurellosis. We see that consistently as a cause of sudden death in particularly younger, in this age group, birth to 1 year old sheep. So, we see inflammation of the esophagus, we see pneumonias, and we see bacteremias, septicemias caused by these bacteria. They're obviously normal inhabitants of sheep's system. So it's usually when sheep are under pressure, under stress, there's a concurrent parasitism, or they're slightly strained nutritionally wise. And this then is where we see these pasteurellosis kicking in and causing sudden death. Clostridial disease, I know Charles is going to refer to this as well, consistent cause of sudden death in sheep. Pulpy kidney disease, one of the common causes of sudden death that we see coming through the lab. And respiratory diseases can also refer to these pasteurella diseases. I think it's probably no harm just to mention Teagasc, ourselves, UCD, and the drug companies, the stakeholders, have come up with these 3 steps, 3 kind of simple, straightforward steps, because I know this can be a bit of a quagmire to try and get sort of very concise messaging across. So this is the aim of these 4 steps, is don't dose unless there's a demonstrated need. So unless you have a Haemonchus contortus problem, or you have yolk hoggets that are slightly under-conditioned or are under pressure, have had multiple lambs, then they obviously might need a dose. But other than that, adult yolk should have good resistance to worms and shouldn't need a dose. Use your white trenches, your benzimidazole for nematodiarus in the early season, because there's very little resistance shown to white trenches, and it's a good use of your white trenches while keeping your other actives, your clear and yellow doses for later on in the season. Always do a quarantine treatment for bought-in sheep, so always treat those with a prescription-only drug or 2 to 3 actives to try and clear out any resistant worms, so you don't put them into your worm population on your farm. And always make sure then to put them on to dirty pastures, so that those, if there is still some remaining resistant worms, that they're being diluted out by susceptible worms. And routinely use fecal egg counts and drench tests, so that you're really keeping on top of what's happening on your farm. This is just a picture of a wet lung, which is how we would describe it. So it's full of fluid. That's because it has a bacteremia, septicemia. And what that does is it causes your vessels to become leaky, and it drains all this fluid. So this lamb then will be struggling to breathe and will be quite toxic and quite septicemic. This is a kidney, or I guess what's left of the kidney from a general bacteremia, septicemia. So this is what we see in lambs that have chronic naval infections. and ascending infections up through their navel. So I think, again, it's apologies if this is difficult to look at, but I think it does give a very good visual of what actually the bacteria coming in through an undipped navel will actually end up doing. So I think I hope it's useful. Cause of death in adult sheep, we're still looking at pastorellas can cause death in adult sheep's metabolic nutrition. So you're talking about your twin lamb diseases, you're talking about your hypocalcemia, your milk fever, then GIT infections. So you can be talking about salmonella infections. You can be also talking about your Haemonchus contortus, and then systemic infections, your bacteremias, septicemias again. So this is a lung. So your lung should be nice and pink and air-filled. There's a lot of fibrin and inflammatory exudate on this lung. So this is typically what you see in a Mannheimia hemolytica. Again, I'm putting this up just to show that you can imagine that the treatment of this disease is going to be very, very difficult to get antibiotics in to resolve that level of inflammation. So that's why it is so important to try and vaccinate, and also then not to be putting your sheep under pressure with concurrent diseases, so that they're able to fight these infections and not get them and keep them in their upper air tracts and not allow them to colonize their lower respiratory systems. This is a more chronic pneumonia that we'd have got a Pastorella multocida from. And we'll come to this again slightly later under our Thinio survey. This is a pneumonia that some of you might be dealing with on your farm or might have heard of, this Yaxiecta, this ovine pulmonary adenomatosis. So it's basically a cancer of the lungs. It's an infectious cancer of the lungs, and there is no treatment for it. So culling is your only option. But again, I think these things are not to be something to be feared. They're something to be realize you may have it and then come up with a control program for it. Oops, it is it. So again, I'm always keen to manage expectations, because I think some people get frustrated with the labs in that you think you don't get any reports. I've heard that a lot of times. We always send a report to your PVP following when we actually look and do the gross postmortem. That day or the following morning, an initial report will be sent to your PVP. Then, as we get results back, a report is sent. So routinely, your vet will get 3 or 4 reports on every submission that comes into the lab. So please follow up with your vet. If you haven't got results, there will be results from your submission with your PVP. If you don't get a result, I mean an actual diagnosis as to what caused the death or what caused the ill thrift in your sheep, please keep submitting. And so the 2 or 3 of your freshest abortions or dead lambs or perinatal mortality, we are here to help. And that's our only function really, is to help the agri sector and farmers. I suppose herd health, just to synopsize before we briefly go on to some of the things that we see through the lab, is all about that connection between the environment. So if you have an environment that's dirty with a lot of an infectious pressure, no matter what you do with your animal, you're going to get disease. If you have an animal which is the host that is under pressure, malnourished, has coexisting diseases, you're going to find it very, very difficult to keep that animal healthy. And then last, you have the actual causation, so the bacteria or the virus or the parasite. So you need to also keep them controlled. And it's the interaction of those 3 that will result in disease. I guess this is what we've seen this week and last week, just a few cases just to show you. So we saw an acute and chronic fluke in the same animal. So it was an ongoing active fluke infection in this animal, because they're adult fluke coming out of the gallbladder, but there was also hemorrhagic tracts and a very pale yolk from acute fluke infection. So there had to be a review of antibiotic use there and parasite control. This is what we saw very, very, very frequently during summer, autumn of this year, was this Haemonchus contortus, these very pale sheep. They didn't have diarrhea. They were pale. If the disease was slightly longer in its course, they also might have had a bottle jaw. So when you think of pale sheep and a bottle jaw, you can jump to liver fluke, but this in fact, so there's the bottle jaw here and the very pale eye. This, in fact, was a barber pole worm, this Haemonchus contortus worm. So the Haemonchus contortus worm, because I guess due to climate change, its spread has reached as far north as Sligo now, whereas it was typically a disease of the southeast, the sunny southeast and the south. Now it has been seen all over the country, but I certainly think we would have got more than our fair share of it because of our climate down the southeast. So I'll just point it out to you. So this is the barber pole worm here. So you can see the way it looks like a barber pole. That red coloration is because it is a blood ingester. So that's blood in its intestinal tract within the worm. And that's what causes the anemia. So the larval stage 5 and the adult worm actually are in the abomasum, which is the true stomach of the sheep. And they ingest blood there, causing the anemia. So again, it's worth noting that diarrhea isn't the feature. Another key feature, this is the barber pole worm again, here and here and here. So a feature of this disease is that it produces huge amounts of eggs. So not infrequently, we would get 15,000 or 20,000 eggs per gram in the fecal samples from these sheep. So you can imagine that number of worms in the stomach is going to ingest quite a bit of blood and cause weakness and anemia and then death if this isn't picked up and treated very quickly. Again, when we think worms, we think diarrhea. This is not the case with this worm. It can be treated with most anthelmintics plus any of the flucicides with nitroxanil or clasantin. And there's just another one there. So very common diagnosis in 2015, because we felt it probably was around. We did a survey on springborn lambs using PCR technique, and 29.6% of them were PCR positive for Haemonchus contortus, and they were countrywide. Another cause of sudden death in lambs, which we're seeing quite frequently, we've certainly had a number of cases, is with this history, moving from depleted winter crops to a new pasture plus or minus meal supplementation. So where a winter crop is becoming scarce and farmers are allowing the lambs to get the very last of it and then moving them onto a flush crop of it or into pasture and supplementing with meal, and we're getting this acidosis, ruminal acidosis, grain overload, or barley poisoning. So we see these rumens full of grain, and then you have this soupy material, and it's basically poisoning the sheep, and they have very low pHs, so their rumen becomes very acid. And then just another one that we see, not so much this time of year, any time of the year, I guess, but is sheep with bloody urine. So when we think of that, we think of these jaundiced sheep and we think of copper poisoning. Sometimes it's the feed is to blame, but usually, more frequently, it's inadvertent supplementation of copper, in that copper is given, and that's fine, but they're also getting copper from another source, maybe from meal or small amounts of it or whatever. Just to mention very briefly, and I'm nearly finished now, so please bear with me, the Thinio survey. So ourselves and Teagasc are working closely to try and get a handle on what these iceberg diseases, their prevalence or their role in ill thrift in sheep. So most of these diseases, of which there are 5, cause ill thrift in sheep. So if in your flock you have ewes that are thinner than they should be, despite adequate nutrition, we would be more than happy to take those 3 of those, and you contact your lab or your Teagasc advisor, we'll put them down in the lab and we'll test them free of charge, and we'll be looking specifically for these iceberg diseases, but obviously we'll be testing for parasites and other diseases as well, or broken mouths or those common causes of ill thrift. But we will certainly be testing for the 5 iceberg diseases. They're called iceberg disease because sometimes they can be very inapparent until the level becomes quite high. So border disease, which is very similar to BVD in cattle, the casus lymphadenitis, which causes lumps, the Maidi visna, which can cause chronic pneumonia, ovine Lyonnaise disease, which typically causes ill thrift, not diarrhea, and then the pulmonary adenocarcinoma, which is the EXICTA, which we referred to as before. So this is Johne's, thickened inflamed bowels causing ill thrift, typically not diarrhea. Border disease, we don't pick it up that frequently, but it can cause these little hairy shakers, they're called. So they have a little tremor, and their hair is quite wiry and curly. Then we have Medivisna. So we detected it in the lab in Kilkenny in 2020. The first case of it in Ireland was confirmed here. So again, this is one of these long chronic diseases. In Ireland, it's the pneumonic form of it, which we've really only come across. We haven't seen the Visna form, which is the nervous form. It also causes a chronic mastitis. Control options for any of these iceberg diseases, there's no treatment. So the control really is knowing you have it, putting in a control plan, and also to cull positive animals. CLA, again, these abscesses caused by Corynebacterium pseudotuberculosis, treating with antibiotics is unsuccessful. So again, you want to know what the incidence of it is and try and cull it out. There is a blood test for it, which you can use to assess your exposure within your flock. And these are the control options, screening and culling. And then this is your OPA again. These, what they look like are kind of fatty lumps in the liver, but when you look at them on histopathology, then you see these little cancerous growths within the lung. So the aim and the purpose, final slide, is provide information on the causation and etiology of disease processes causing chronic ill thrift in sheep, in Irish sheep flocks. So really, we'd appreciate it if you consider it. We hope it'll be very useful to you if ill thrift is a problem, because there really is no point in feeding sheep with these diseases, because all they're doing is spreading it to other sheep, and they will not get or improve from these diseases. So we'd be very amenable to any of you who are listening to or tell others about it if ill thrift is perceived as an issue. Speak to your Teagasc advisor or your PVP, and it can be arranged to drop them into the lab. And as I say, we'll humanely put them to sleep, and we'll carry out testing for all these diseases plus others free of charge, and report back to your PVP. And hopefully then you can start a control program for it. So that's it. As always, I'm a mouthpiece, so there's a lot of staff here in Kilkenny RVL who help us all the way. So I'd like to thank those, also colleagues in the other RVLs throughout the country at Loan, Cork, Dublin, Sligo and Limerick, and the Teagasc advisors, and obviously to you, the farmers, for listening. Thanks very much.
Thanks, Maresa. Very comprehensive talk. Covered a lot of ground, and it looks certainly topical at this time of the year. Maybe just when Charles is getting ready, I might just throw you a couple of quick questions. We've one in here in the Q&A, and so we've one in at the moment, and it's probably timely. In a flock where an abortion starts, and look, a lot of these problems only ever start on a Friday evening when everything's closed. That interval from when the animal aborts to when it's submitted, that obviously has an impact. Can you preserve the placenta, the fetus, over the weekend? Is that possibility, or how close to submission has it to be?
Like if that was an adult animal or even a calf or a weanling, I'd say absolutely it's probably not the one to submit. But actually for an aborted fetus, you have a little bit more time, because a lot of the testing is done in the laboratory as opposed to a visual exam or actual examination of individual organs or seeing changes in those. So I'll put it in a cool place. Do not freeze it, because that's the temptation is that you freeze it and it'll be fine, because it takes a long time to thaw. It can disrupt the tissues. So our advice is absolutely keep it as cool as you can, and it should actually be okay to submit. As I say, if it was an adult ewe or a lamb, I'd say absolutely not, because they're covered in wool and they basically go off very quickly. But for aborted material, I would also stress though that chances are you will have another one. And if you do over the weekend, give us the fresh.
You would hope, of course, to be fingers crossed, but could be the start for someone. Again, Maresa, like that submission as clean as possible. You know, the bag and that you don't want to contaminate with any other sources.
No, but don't worry too much. Put it into a mineral bag or put it into something like that. Put the placenta into a long glove. Seal it. Just from your own point of view, make sure it's leak proof for your boot if you're coming with a boot, because sometimes we see and go, I hope there isn't shopping going into the boot after that, so
Yep.
just for your own point of view, because remember, the abortifactant agents are zoonotic, so particularly women of childbearing age, they really have to be careful. So that's the one thing sometimes that you kind of go, Jenny, God, or put into a bucket or something, because a lot of those bags actually aren't leak proof. You think they are, but you lift them up then and so double or triple bag it, but don't worry too much about what that looks like. It'll be fine.
Just to follow on from the last question, like a lot of these diseases are zoonotic. I'm thinking the chlamydias, the salmonellas, the importance of hygiene, particularly for the operators in a lambing shed and those in the household as well, that can't really be underestimated.
No, it's very, very important. And I think when people are under pressure and tired and in a rush, things like we all do, it's kind of slips down the importance. But I think it's really important to leave your footwear and your pull-ups at the back door, especially with small children, like children crawling around and that. We have heard kind of stories of, children that are crawling out and all of a sudden their hands are on top of Wellingtons and stuff like that. The advice really is that anybody pregnant or who could be pregnant shouldn't be in the lambing shed. Again, we've had people who have been very worried here, ringing us and saying, look, we just got a diagnosis of this and I'm pregnant, and that's a very worrying time then. And so really you have to take a lot of precautions, especially children around lambing sheds. You really have to supervise them washing their hands and stuff. So just basic stuff, and no eating or drinking in lambing sheds. I suppose that would be a risk. And wear gloves, wear your long gloves if you're lambing those, and even wear the short, get a box of those at the start of the lambing, and at least then you're taking them off before you go back into the house. And hand washing, just basic hand washing. So look, I know everyone listening knows this stuff, but it's probably no harm just to remind yourself before it kicks off, just to put a few little things, bits of foot baths, leave clothing outside, wash them frequently, just stuff like that.
It all seems very basic, but it's a very small investment just to safeguard your own health and indeed the animal's health as well.
Yeah, and especially then if you have, say, older people or people with, who go undergoing treatment for cancer, that they're the real high risk people that, healthy people that are up all night lambing ewes, there's probably fear of them, they'll put it behind them. But then you are coming back into a household that maybe with more vulnerable people, and they're the people you kind of watch out for.
I think I also have to be conscious too. Our own immunity tends to wear during lambing, and sleep is limited. Look, just maybe on that one as well, in terms of transmission of some of diseases, some are obviously sheep to sheep. I'm thinking chlamydia here is one. Even the work gear that people are wearing, that is a potential risk of transferring disease from farm. For instance, if you lamb for a neighbour or something else, really that gear should probably be left behind you, or different gear, or disinfected.
Oh yeah, like if you're lambing for somebody, get them to get you a pair of pull-ups and a pair of Wellingtons, and you just wear those in their farm. Or even like lads who are, I know it's lads coming on milking, they should have dedicated aprons or whatever in cattle farms, and likewise with, and you know what, it's I don't think anymore is it kind of rude or thing to insist that people do that. People are kind of aware of that now and are more accepting of that. And if you kind of go, look, there's a pair of pull-ups there for you and there's a Wellingtons, people just accept that, and they're half glad of it, because it takes the pressure off them. They just wear that and they leave that there, they leave coats and whatever. And as well as that, just even normal stuff around taps, a bit of soap and a bit of paper, hand towel, and don't bother about the hand towel out from the kitchen, just a bit of a paper dispenser, and use that to clean hands and stuff. Just basic, simple stuff, just if you have a week or two now before things kick off, just to maybe think about a few simple things, go down to the creamery and get a few things like that. It would make a big difference.
That bit of preparation also helps. The tenure survey, look, I think it's an important survey, and I think it's probably fair to say any of us that work in industry and work with farms, we see a cohort of tenor ewes and flocks. Likelihood is that iceberg diseases, we probably have a lot more flocks out there that have them that aren't aware of it. So just in terms of submission, do you have to receive all those ewes together, or as people go through them, like particularly post-scanning, maybe handing them for that clostridial vaccine, if some ewes are gone very thin for no obvious reason, can they be submitted in individual numbers, and how do you go about submitting them to the labs?
They can. Look, we want to see as many sheep as possible, so we'll be as accommodating as absolutely possible. So if you're anxious to give one or two more of them a chance to turn around, and you think that maybe they will, that's absolutely fine. And if we get a diagnosis in the first one, that's good enough, because if we got a diagnosis of one of these iceberg diseases in one of your sheep, there's very little chance that it isn't in other sheep in your flock due to the nature of these diseases. But ideally, look, if you have 3, I suppose from a realistic point of view, even though I know they've fallen back a bit, but sheep prices were very good, and I suppose people are anxious to sell as much as they can, and we understand that. But if they could maybe just think slightly more long term and kind of go, you know what, I think this is a bit more serious, and I really need to find out. Look, we probably think these iceberg diseases are at a pretty low level, because in our routine surveillance, we're coming across some of them, but we're not coming across them. So I don't think there's any reason to be fearful. And I think it's always better. It has to be always better to know and to try and get on top of the problem. And there are ways of, it'll take time. It mightn't be that simple, but I think it's better to know and try and cull out that problem out of your flock if you can. So look, absolutely, we'll be as accommodating as possible, because we're very anxious to see these, and we do a lot of testing on them. So even if it isn't an iceberg disease, we should be able to tell you something that will be of use. Like of those, some of them we've done, really it's parasitism we've come across as a big problem, and ongoing kind of changes that so that's also very, very useful information.
I think, like, in fairness, there is a bit of a stigma around some of them diseases, but the like of OPA, that if you have it in your flock, it's going to hit performance massively. It's going to hit you financially. And the only way to control it is identify and start culling from that.
And like even with that disease, like there's advances being made all the time. So I know Teagasc have done a lot of work with scanning ewes to try and pick up that disease earlier, so that you're getting those sheep out of your system, so that you're not spreading it to other sheep, and that can only be a positive thing. So there's advances all the time. Testing is becoming a little better. So, and there's lots of advice there to try and deal with it as well. So I don't think it's anything you should be afraid of, because I think not knowing and having it going on insidiously in your flock is more of a risk.
We'll leave it there for this episode. I'd like to thank Maresa for giving up her time to come on the webinar with us. Always useful getting that update each spring. A full recording of the webinar with both herself and Charles is available on the Teagasc YouTube channel, and it's well worth having a look at. That's it for me for this episode. For any updates from our sheep programme, keep an eye on our Twitter page at Teagasc Sheep. I'm Kieran Lynch. Thanks for joining us. Don't forget to tune in future episodes.